there's very few supplements I recommend universally for almost everyone. But and vitamin D is one of them. I mean, to me, it's just recklessly irresponsible for your human health not to address that and pay attention to it.
If you are vitamin D deficient, 50% higher risk of having a heart attack. And if you have a heart attack and you're vitamin D deficient, 100% risk of dying of that heart attack.
It seems like the biggest impact is cancer. I mean, it's affecting almost 1 in 2 people. And the impact of vitamin D, it could reduce that by up to 50%. I mean, it's like virtually free. And I believe it's far more prudent, safer, less expensive, and most importantly, far more effective to optimize your vitamin D levels and go through the potential serious risk of exposing yourself or loved ones to a flu vaccine.
And I usually recommend that vitamin D is critically important from birth until death.
Welcome everyone, this is Dr. Mercola, and today I'm joined by Dr. Michael Holick, who is a leading researcher in vitamin D. And you probably, of course, know about the importance of vitamin D, and I was helpful and responsible for educating the masses on this, but that was in the early 2000s, and because information became available in the literature because of leading researchers and clinicians who had really done some pioneering research. And Dr. Holick is one of those people who really helped advance the understanding of the massive importance of vitamin D far beyond its influence on bone metabolism. So we're really honored and delighted to have him with us today. He is a double doctor. He is not only an MD, but he's a PhD. And he's written a book, The Vitamin D Solution. He's based out of Boston and I believe works with the Harvard set of hospitals. So welcome and thank you for joining us today, Dr. Holick.
Oh, it's my pleasure. Thank you for that kind introduction.
So I'm wondering if you could provide our viewers with a brief history of how you first became interested in vitamin D and what brought you to study it really carefully and then expand on its importance to human health.
Well, I've really been blessed. I've been doing vitamin D research for more than 40 years. So as a graduate student for my master's degree, I was responsible for identifying the major circulating form of vitamin D, 25-hydroxyvitamin D, that doctors typically measure now for vitamin D status in their patients. For my PhD, I identified the active form of vitamin D while working in Dr. DeLuca's laboratory. And then I went on and...
Excuse me, is the active form the dihydroxy?
Correction, 125-dihydroxyvitamin D. It's the active form of vitamin D.
So, so many areas that we can go into. What areas would you like to focus on? I've got a lot of questions, but is there anything that you'd like to highlight that we can start the discussion with?
Well, I think that just like the Vitamin D Solution book states, that it's really a 3-part process, how to both prevent and treat vitamin D deficiency. So I think that would be a very good way to start out. Also
Okay.
to talk about the worldwide epidemic of vitamin D deficiency and its health consequences for pregnant women, for children, and for adults, and some of the more recent research relating vitamin D deficiency with increased risk for many chronic illnesses. Before the year 2000, very few doctors ever thought that anybody was vitamin D deficient. And then we began to realize around 2000 that as more and more studies were being done, especially from the National Health Survey, that vitamin D deficiency was very common. The CDC, for example, reported that 32% of children and adults in the United States, throughout the United States, that they evaluated were vitamin D deficient. From the National Health Survey, children 1 to 5 years of age, 50% vitamin D deficient or insufficient, 70% deficient or insufficient, ages 6 to 11 years of age. We estimate probably about 50% of the population is at risk of vitamin D deficiency and insufficiency.
And what standards are you using? Because there's some controversy as to what the cutoff limits are. Some people say the old standards were 20 nanograms per ml, then up to 35 to 40, and some people like Dr. Hollis, Bruce Hollis, suggested 50 nanograms per ml may be the lower limits of sufficiency.
Well, I think that everybody agrees. The Institute of Medicine, including the Endocrine Society, recommend that at least 20 for bone health, but that there's this area between about 21 and 30 that we consider to be an insufficient level, and that most experts agree that if you're above 30 nanograms per ml, that this is a healthy level to be at. And because there's variability in the assay, the recommendation from the Endocrine Society practice guidelines, who looked at all the literature and made recommendations for prevention and treatment of vitamin D deficiency for doctors, is 40 to 60 nanograms per ml. And there's a group down in San Diego, Grassroots Health Panel, that also has been looking at this issue and also recommends 40 to 60 nanograms per ml as the ideal level. I treat my patients on average with 3,000 units of vitamin D a day, and it's been very effective. And I've published a paper that over a 6-year period of time, most of my patients on a 3,000 unit equivalent a day is between 40 and 60 nanograms per ml, and there is no toxicity. Also, if you're obese, you need 2 to 3 times more vitamin D, so that could be an issue as well. But for my patients who are normal weight, usually 3,000 to 4,000 units a day is adequate to maintain a healthy blood level of 25-hydroxyvitamin D. I personally take 3,000 units a day. My blood level on average is about 55 nanograms per ml.
Okay, now again, you're in Boston, which I would say half the year it's almost physically impossible to get enough sun exposure, even if that was your life's goal, to raise your vitamin D levels to therapeutic levels. I'm a firm believer, in fact, personally have not taken oral vitamin D for 3 to 4 years, yet my levels are in the 70s, 70 nanograms, because I believe the best way to get it is through sun exposure or a safe tanning bed. And I'm wondering if you can comment on your experience and review and about the differences between the two and the benefits. Because to me it seems, yes, I want to get my serum levels up, but there's probably other benefits from being exposed to the sunshine on your skin, because there's a lot of wavelengths in there aside from UVB that may be beneficial to human health.
So I think that you're right. And we had shown many years ago that during the wintertime, if you live above Atlanta, Georgia, you basically cannot make any vitamin D in your skin from about November through March. And so obviously you need to either take a supplement or, like you said, is to use a tanning bed or a ultraviolet light that will produce vitamin D, like the Sperti lamp, for example. And so I typically recommend, if you're going to go out to the sun, that yes, arms, legs, abdomen, and back 2 to 3 times a week for about half the time it would take to get a mild sunburn, followed by good sun protection. And as you're probably aware, that we've recently developed an app, dminder.info, that actually you can use on your iPhone, so it picks up exactly how much UV radiation is coming into your locale, and we can tell you how many units of vitamin D you're making.
It does that, excuse me, not by through a variety of variables that you enter into. There's not a sensor on there that's actually measuring UVB, but it connects to the weather service and looks at the cloud cover and your latitude, longitude, time of day, skin color, age. So, you know, it enters those and it makes a good guess, but it's not a direct sensor.
Right, exactly. And also, and plus it could be anywhere. So you could be in India, you could be in China, you could be even in Brazil. And you can be able to get some sense of how much vitamin D you're making. And more importantly, we also tell you when to get out of the sun so that you don't get a sunburn. But what we do know is that when you make vitamin D in your skin, it lasts 2 to 3 times longer in your body. You also make additional photoproducts in your skin, and there's some evidence to suggest that maybe these photoproducts have some unique biologic properties in the skin, because we do know that sensible sun exposure decreases risk for malignant melanoma, and it could be that some of these photoproducts are helping in that process. Beta endorphin is certainly made in the skin during exposure to sunlight, and that's probably the reason why people feel better when they're exposed to sunlight.
And what is the benefit from your perspective of, other than compliance, of giving it once a week at such a high dose as opposed to giving it regularly at lower doses, on a daily doses?
It turns out that vitamin D is very forgiving, and as you know, it's fat soluble. So when you take vitamin D orally, or even when you're exposed to sunlight, a lot of it goes into your body fat and it's released back out again. And so my patients always ask, so what if I forget it one day? Can I take twice the next day? And the answer is yes. What if I forget it for the week? I could take all 7 doses a week. And so as a result, you could take it easily once a week or once every couple of weeks.
So why don't we discuss some of the new advents, or maybe just kind of briefly review the primary purposes of vitamin D. From my perspective, it seems like the biggest impact is cancer. I mean, it's affecting almost 1 in 2 people. We've got essentially the equivalent of 5 to 6 airplanes crashing and killing people every single day in the United States alone, people dying from cancer. So, and the impact of vitamin D, it could reduce that by up to 50%. I mean, it's just, and it's like virtually free. You know, it's just like insane not to take advantage of this, and let alone the other metabolic diseases like heart disease and diabetes and Alzheimer's. But why don't you give us your take on that? And because I think it's just, you know, there's very few supplements I recommend universally for almost everyone. But and vitamin D is one of them. I mean, to me, it's just recklessly irresponsible for human health not to address that and pay attention to it.
I agree 100%. So, and I usually recommend that vitamin D is critically important from birth until death. And so just to give you a couple of examples, I mean, during pregnancy, we're now realizing that vitamin D deficiency is a major issue for the developing fetus. Preeclampsia, the most serious complication of pregnancy, is associated with vitamin D deficiency. Vitamin D is critically important for muscle function, which of course is important for birthing action. So we showed a 400% reduced risk of women requiring a C-section if they simply were vitamin D sufficient at the time they gave birth. We're now beginning to realize that in utero vitamin D deficiency is more likely that the young children are going to have asthma and wheezing disorders. We're also now realizing that children that are vitamin D deficient are more likely to develop type 1 diabetes, multiple sclerosis later in life, rheumatoid arthritis, and Crohn's disease. We're now also beginning to realize that, like you said, cancer is a big deal. And a study done, for example, at the Nurses' Health Study showed that nurses that had the highest blood levels of 25-hydroxyvitamin D, average about 50 nanograms per ml, reduced their risk of developing breast cancer by as much as 50%. A study done by Dr. Knight in Canada showed that when they called up women with breast cancer and said, how much sun exposure did you have as a teenager and young adult compared to women that didn't have breast cancer, it was amazing to find that women who had the most sun exposure as a teenager and young adult had almost a 70% reduced risk of developing breast cancer. Studies have shown that if you improve your vitamin D status, reduce risk of colorectal cancer and prostate cancer and a whole host of other deadly cancers by 30 to 50%. So you're correct. Cancer is a big deal, and that you need to realize that vitamin D is playing a very important role in helping to maintain cell growth and to help fight cancer when a cancer cell is developing in the body. So vitamin D has a very important role to play. In terms of cardiovascular disease, we now recognize that vitamin D is very important in reducing risk of hypertension, also atherosclerotic heart disease, and then ultimately heart attack and stroke. A study done from the Framingham Heart Study showed that if you are vitamin D deficient, 50% higher risk of having a heart attack. And if you have a heart attack and you're vitamin D deficient, 100% risk of dying of that heart attack. We did a study with Dr. Dong in Georgia in teenage African American boys and girls. We simply gave them 2,000 units of vitamin D a day for 4 months. We raised their blood levels from 11 to 34 nanograms per ml on average, and there was significant reduction in the vascular stiffness, which is the prelude for both hypertension and heart disease. And certainly, vitamin D is very important as an immunomodulator, which is why we think it's so important in reducing risk of autoimmune diseases. But it also helps us fight infections. A study done in Japan, for example, showed that school children taking 1,200 units of vitamin D a day during the wintertime reduced their risk of getting influenza A infection by about 40%.
So I'm glad you mentioned the important influence of vitamin D in improving immune function. And as we're filming this interview, or recording it, because we don't use film anymore, we use digital media. It's the fall, and I'm not sure of your position on vaccinations, or specifically flu vaccinations, but I suspect you might be familiar with mine. And I believe it's far more prudent, safer, less expensive, and most importantly, far more effective to optimize your vitamin D levels than go through the risk, potential serious risk, of exposing yourself or loved ones to a flu vaccine. So maybe you can comment from your perspective.
You're right that we know that the immune cells use vitamin D, that they activate vitamin D. There's good evidence that it will help kill tuberculosis bacteria, for example. If you have adequate vitamin D on board, the macrophages chew it up and will kill it. And we think that the immune system is primed with vitamin D in order to help to fight infections. And that study did suggest in Japanese children that increasing vitamin D intake during the wintertime markedly reduced risk of influenza A infection. And they demonstrated it by both nasal swabbing as well as with looking at the blood to be sure that, that they could demonstrate that, in fact, they did reduce this infection. So I think it is important. And in terms of vaccines, it's debatable. I think you're right. And our hospital, for example, requires us to have a vaccine. And if we don't, they force us then to wear a mask wherever we go. And so, so what to do? So I definitely get a flu vaccine every year because that's a requirement of the hospital, that I'm at, which is Boston University Medical Center.
Yeah. And another artifact that you never mentioned, but I thought it might be useful to discuss, is this conflict between a whole specialty of medicine, specifically the dermatologist, who have pretty strong disagreements with this position, specifically as it relates to skin cancer, and think you're recklessly irresponsible for advocating this. And because of your position, if I believe, you were removed from some academic position at the university because of your, basically primarily motivated by the head of the Department of Dermatology. And maybe you can refine my description of what happened and give us your perspective on it.
I came out in 2004 with the book, The UV Advantage, and I was encouraging people to get some sensible sun exposure. And I happened to be professor of dermatology because of the work I had been doing with active vitamin D to treat psoriasis. In fact, from the Skin Research Foundation, I received their prestigious psoriasis award. And as a result, I was being in the Department of Dermatology continuing to do psoriasis research. But once I began recommending sensible sun exposure for vitamin D, that was kind of counter to what the American Academy of Dermatology's message was. So I was asked to step down as professor of dermatology back in 2004.
So has the position, from your perspective, where you're at Boston University, is there are they starting to get some common sense into their discipline and realize that this is just is archaic? I'm sort of at a loss for a description of the words of their behavior, but it's just not good. So I mean, are they waking up to common sense?
Because you know this much better than I do. I'm always asked that question. How I must have felt really badly. Actually, not so, because the press picked up on it. And even the International Herald, one of my colleagues was in Hungary, and he said, I was on the first page. BU professor fired because of his stance on sensible sun exposure. But you can't buy that kind of publicity. So in many ways, it was really good because it woke up a lot of people's eyes about the issue of sun exposure. Because right now, the American Academy of Dermatology still recommends you should never be exposed to one direct ray of sunlight for your entire life.
They haven't changed. They haven't changed their position. That is just incomprehensible.
a study in dermatologists, by the way, in the summertime. 87% were found to be vitamin D deficient. More than 40% of the population in Australia is now vitamin D deficient. So the Australian Dermatology Society, as well as the Cancer Council for Australia, now recommend some sensible sun exposure. So it is starting to make a movement in the right direction. And there's two pieces of information that I think is probably worthwhile noting. So yes, most non-melanoma skin cancers occur on excessively exposed areas like your face and top of your hands. But most melanomas occur on the least sun-exposed areas, and occupational sun exposure decreases your risk for melanoma. So even though everybody always talks about deadly melanoma and relates it to sun exposure, you have to really put this all into perspective.
Yes, indeed, and that's an important distinction because we don't want to there are basically two types of skin cancer: the regular skin cancer, the basal cell, and the squamous cell, which are for the most part almost always benign, and virtually no one dies from these, and the melanomas. So your risk for developing these benign cancers increases relatively much, but your risk for the developing the other one decreases.
And that's why I recommend arms, legs, abdomen, and back rather than your face, because it's the least sun exposed in terms of long term, so you're less likely to develop even non-melanoma skin cancer. A study was done, by the way, in Maasai warriors who are outside every day, and that really gives us an insight where we should all be with our blood levels of 25-hydroxy-D, and they were found to be around 50 nanograms per ml.
That's why I try to keep mine above 50, for sure. And usually successful to do that, except it becomes a challenge in December, because even in Florida, there's a lot of sun in December and January. I mean, there's sun, but it's not enough UVB, actually, is what I more specifically meant to say. So another area that most people aren't aware of is the fact that glass is a relatively recent innovation. It's not been around for that long, certainly not centuries. And as a result of that, when it was available, it was very expensive. So now it's pretty common to have glass everywhere. And many people feel that when they're getting sunlight through a glass, a window, car window, office window, home window, that they're going to be producing vitamin D on their skin. But the point I'd like to make is that almost all glass selectively filters out UVB, which produces the vitamin D, and it doesn't filter out UVA at all, which actually increases the risk of cancer. So one of the worst things you can do to improve your health is to get sun exposure through a glass. And I'm wondering if I've got my perspective is distorted on that.
No, it's perfect. You're absolutely right. You cannot make any vitamin D when you're exposed through glass. And yes, you're getting blasted by UVA, which penetrates deeply into your skin, causing wrinkling, increasing risk for melanoma, as well as probably skin cancer. Also, what's curious, and we've shown that if you're exposed to sunlight like at 8 a.m. in the morning, which is what also has been recommended, or late in the afternoon, you actually are getting blasted again by UVA radiation and no UVB. You can't make vitamin D until about 10 o'clock in the morning, until about 3 o'clock in the afternoon.
Yeah, it's just crazy because the recommendations for safe sun exposure are the ones that will not give you vitamin D.
Exactly.
And if you want to optimize it, here's another important nugget that many people may not appreciate, because as we're filming this, it's the time between spring and fall. And it's essentially, we're in daylight savings time in the United States. So daylight savings time, the peak sun exposure is not noon, it's 1 o'clock. So if you want to get your maximum sun exposure, you go around 1. After that, you have to go to 12. So, just because we change the clock, that doesn't mean, we have to compensate for that. So that's another, yeah. So the other thing that I wanted to mention is your take on I guess keeping your skin cosmetically elegant. And of course, we are both strong advocates of sun exposure. But your face, which is the most important cosmetic component element of our body, is a relatively small surface area and it's really the one that most people, the only part of their skin they expose to their body. But if you protect your face and expose your chest and your back and your legs and your arms, you don't really have to worry about vitamin D. So it would seem wise and prudent exposure for cosmetically to protect your face, and I personally use a cap that puts a shade in between around my eyes and to my nose, and I do it that way just to protect my skin, because the skin is very thin in your face and highly sensitive to this photoaging effects of UVB or UVA actually, sorry. And so I'm wondering if you've developed any hints over the decades that you've been involved with this.
And so no question about it. So if you put a sunscreen on with a sun protection factor of 30, reduces your ability to make vitamin D in your skin by about 95 to 98%. But I always recommend sun protection on your face. And often a broad rim hat is by far even a better way of doing it, rather than having to put a chemical on your face if you don't have to. But it's certainly important to protect your face.
I guess that summarizes most of my questions that I wanted to dialogue with you about, but I'm wondering if you have any other items you'd like to highlight or emphasize as we conclude.
So one of the things that often happens in the wintertime is that people feel more tired. They also have aches and pains in their bones and muscles, and they often are misdiagnosed as having fibromyalgia or chronic fatigue syndrome. And many of these symptoms are classic signs of vitamin D deficiency, osteomalacia, which is different than the vitamin D deficiency that causes osteoporosis in adults. And what's happening is that the vitamin D deficiency causes a defect in putting calcium into the collagen matrix, into the skeleton, and as a result, patients have throbbing, aching bone pain. And if they take adequate calcium and vitamin D, and I think we haven't really talked very much about calcium, they go hand in hand. I mean, I typically recommend getting your calcium from your diet if you can, but if you can't, then certainly 1,000 milligrams of calcium a day split into 500 milligrams twice a day with meals is really a good way to get your calcium, and having adequate vitamin D will help maintain your bone health as well as muscle function. Often elders have muscle weakness. They have a difficult time getting from a sitting to standing position. That's classic for proximal muscle weakness associated with vitamin D deficiency. And many of my patients do incredibly well by just simply correcting their calcium and vitamin D deficiency.
Yeah, and the reason you mentioned that, of course, is for nearly a century or longer, really the only known action of vitamin D was to improve calcium absorption. So they're intimately associated and connected. But if you optimize your vitamin D, then you're going to improve calcium absorption normally and may not need a supplement. I personally am not a big fan of calcium supplementation and don't recommend it, and think that magnesium, if you're going to take a mineral, may be far more important, because there's, like vitamin D, it's somewhat of an epidemic of deficiency, and it's somewhat difficult to get in your diet, even if you're having lots of green vegetables. And then the other comment too is, we talked about safe tanning beds, safe being the critical component. Then you talked about the sun lamps from Sperti. And as I was first investigating this in the early 2000s, I was intrigued by that and actually contacted the Sperti Sun Lamp people, and I got one. But it's such a small device. I mean, it really only casts like a foot. So, and then the thing, because of the FDA, is required to shut off after 10 minutes, and it takes like 10 minutes to turn the thing back on because of the mechanics of the bulb. So it becomes almost impossible to get a therapeutic level of vitamin D with enough UVB exposure, as opposed to a tanning bed, which can expose essentially one whole side or both sides if you have a bed of your body. And it seems to me a lot more efficient way to do that.
Real issue, of course, is that for a person that may not be able to afford a tanning bed, this may be an alternative. I have a lot of patients actually that have used it. What they do is they'll expose their abdomen and back or their thighs, and it works reasonably well. As you know, it's been kind of redesigned so that it has fluorescent tubes now, so that you don't have to shut it off for 10 minutes to turn it back on.
Oh, I didn't realize that. Yeah.
So there continues to be improvements. And what I recommend for people who are going to go to a tanning bed is to protect your face, right? And then to go in for half the time recommended for tanning, and make sure that that tanning bed is putting out UVB radiation. Because I just had a patient today that told me that she was getting exposed to very intense UVA, because they were telling her that this will help her make her vitamin D. It will not. And UVA will definitely damage your skin. So I always recommend, always go to a tanning bed that has UVB, half the time recommended for tanning, and always protect your face.
Yeah, and in fact, there are tanning beds that do not tan you because they make no UVA and they just make UVB. So it's not as popular, but if you're only doing it for health perspective, that is an option, UVB only.
Tanning beds, what they do is that they have a small component, usually 3 to 5%, maybe up to 6% UVB, and the rest is UVA and visible radiation. So those fluorescent tubes kind of somewhat mimic sunlight to some degree.
Yeah, and there are tanning beds that have up to 10% UVB, which is double the amount of normal sunlight, and then even less UVA than normal sunlight. So theoretically, at least, safer than sunlight.
Right.
Yeah. So, all right. It's been a delight. Do you have any other final comments you'd like to mention?
Well, just one other, and that is that we did a study recently because we asked a simple question, and that is, how does your body really know your vitamin D status? And ultimately, it's probably your genes that know. And so we did a study in healthy adults, and we gave them 2,000 units of vitamin D a day for a few months. And we got the white blood cells and looked at the broad gene expression of over 22,500 genes. And long story short
Is that the entire genome?
Pardon?
Is that the entire genome?
That's correct. Yep. And so we got the white blood cells at the beginning and at the end of the study. We identified 291 genes that were influenced just by increasing your vitamin D intake. And these genes control up to 80 different metabolic processes, from improving DNA repair to having effect on autooxidation, which is, of course, a big deal for aging and cancer and the like, also for your immune system, as well as for a lot of other processes. So we think that it really is important for people to be aware of their vitamin D status. And needless to say, if you want to get some more information, the vitamin D solution that came out in 2010 that I wrote really kind of gives you a very broad overview about all the health benefits of vitamin D, as well as at the end, question and answers about lots of things that people ask about. And just one example is that it's been suggested that if you increase your vitamin D intake and you have kidney stones, it's going to make that risk even higher. And the answer is that is not correct, that you will not increase your risk for kidney stones if you increase your vitamin D intake. So I want to thank you very much for the opportunity to share my thoughts about vitamin D with your audience, and you've just been a wonderful host. Have a delightful day.
All right. Well, thank you very much, and keep up the good work.